The complementary feeding period, when foods are introduced to a child's diet alongside breastfeeding, is a critical window. This time, from 6 to 23 months of age, sets the stage for health, nutrition, and development for the rest of a child's life. But good nutrition during this period is not simply about adding foods to a child's diet. It's also about ensuring those foods are safe, nutritious, and fed with love and care for their growing body and mind. A child's diet between 6 to 23 months influences cognitive development, future health outcomes, and overall well-being. Yet today, millions of children aged 6 to 23 months are not getting the nutrition they need. Only half are fed often enough, and less than a third receive the variety of foods essential for healthy growth and development. And for many children, this gap is not just about missing nutrients, it's also a gap in the opportunity to thrive. Adequate and optimal complementary feeding is not only about consuming nutritious foods, but also about avoiding those that are nutrient poor and high in sugar, salt, and unhealthy fats. Unfortunately, many infants and young children are increasingly consuming energy-dense, ultra-processed foods, including sweet beverages, which can displace the intake of nutritious foods and breast milk, contributing to poor dietary habits and increased health risks later in life. In Asia and Africa, 1 in 4 children live in severe child food poverty, getting only 2 food groups or fewer each day. The problem is even more challenging for children in rural areas or from the poorest families, who are less likely to have access to diverse and nutritious foods. Structural barriers, such as lack of access to diverse foods, nutrition services, and community support due to financial and physical barriers, play a major role in determining the quality of complementary feeding. But change is possible. We know what works. We have clear evidence-based guidance and examples of success. By working together to ensure that all children have access to nutritious foods, appropriate services, and supportive practices, we can give every child the best start in life. Collective action is essential to address these challenges. By drawing together the efforts of governments, policymakers, donors, and civil society, we can create meaningful change to improve the diets and health outcomes of young children worldwide. Together, we can close the gap and make sure every child, everywhere, gets the nutrition they need to survive, thrive, and reach their full potential.